testing on this patient revealed lab high, okay? Lab high white blood cells. I said he came in a flare. Well, when you're flaring with an autoimmune disease, the immune system may be too high, okay? It depends how long an acute or chronic your issue has been. He came in acutely flared with white blood cells, even though he was finishing up a steroid taper. He also came in with lab high neutrophils, absolute neutrophils. And with those lab high neutrophils was lab high myeloperoxidase, which is the oxidative stress component that neutrophils create that drives inflammation and significant tissue damage. So getting the neutrophils down is going to be very important in this patient's case. And because neutrophils are the most numerous component of the innate immune system, if we can lower the neutrophils, you'll also lower the total white blood cell count, which will be very helpful. This patient also had lab high IgE antibodies. And IgE antibodies are the antibodies that drive allergy. He also had lab high immature granulocytes. And those are immature white blood cells that are being released from the bone marrow too early to help mount a response to what his body's fighting. In this case, it's a flare of ulcerative colitis. Think of immature granulocytes as soldiers in boot camp that have not completed boot camp yet. Or kids in high school that are in ROTC, right? So if we have too many immature granulocytes in the blood, these kids are being sent out to war too soon before they've completed their training. That's not good for health, and they're probably not going to efficiently kill the bad guys. And then lastly, immune-wise, his neutrophil to lymphocyte ratio, or NLR, was lab high at 3.26. Anything above 2 is lab high, and a high neutrophil to lymphocyte ratio reveals chronic systemic inflammation. So he's inflamed everywhere, okay? And it also reveals increased cardiovascular risk. There's over 1,000 papers on neutrophil to lymphocyte ratio and how important it is. So again, getting that down is crucial, and the way you do that is lower the neutrophils. So we can see one key part of his case is to lower neutrophils, which will create many benefits for us. It'll lower neutrophils, lower neutrophil lymphocyte ratio, lower white blood cell count, lower myeloperoxidase, lower tissue damage and immune inflammation.